Welcome to SPED 738. In this module, we're going to take a look at students with multiple disabilities. At this point, you should have read the chapter on multiple disabilities, chapter 11, and then there's also an additional reading on working with children with multiple disabilities in the classroom and some top 10 tips for teachers. So one of the things we want to look at, of course, because this course is all about characteristics, was really looking closely at the characteristics of students with multiple disabilities. Then I want to take a look at some of the evaluation eligibility factors and spend a little bit of time looking at communication devices. This is a typical type of assistive technology that students with multiple disabilities will use. Then we're looking at including students with multiple disabilities in the classroom and some things about assessing progress, some state assessment things that we look at when we're working with students with multiple disabilities. When we look at defining what a student that has a multiple disability, what that looks like, well, typically they have more than one disability, hence the title of it, with a combination of needs, whether it be intellectual, motor, adaptive, sensory, or communication. A lot of times we will see these students also have some sensory issues, so they may have hearing or vision loss as one disability, along with maybe some motor issues or intellectual functioning issues that impact their learning. So when we look at that multiple disability category, we're looking at a combination of needs from students. When we're looking at characteristics specifically, here we're talking about pretty much adaptive skills, so those independence, self-care skills. Typically these students have challenges in independent skills, self-care skills because of their disability. The picture that you see here is actually a kiddo that we work with in our ministry at church, and she has multiple disabilities. You can see that she is in a wheelchair. She has a disorder that impacts the way that her body functions in terms of regulation. So regulating temperature, heart rate, blood pressure, all of those things. And it really impacts her during the school day because those systems can kind of get out of whack and really create a medical emergency. And so that also impacts her. She's nonverbal, but intellectual functioning wise, she definitely knows what's going on. She wants to have friends. She's a typical 7th grader. If you spend time with her, you get the eye roll that you get from middle school students. And she has some really good friends that she's gone to school with all the way through school. Her mom is very good at promoting friendships, promoting activities for her to be involved in the classroom, to be involved in extracurricular activities. She's on the cheerleading team and get some of those experiences so she makes those social connections with her friends. Have friends over to her house to play and spend time with her. And that's a big deal for her. What I'm going to try to do within this video is connect characteristics to students that I know and that I work with, just to paint maybe a little bit more of a picture on what that looks like. Now, for this student, the parent really wants to promote independence for her. And so when she initially started school, she had a nurse that was with her one-on-one. And then she had a para that was with her one-on-one. Mom really pushed for them to not necessarily have a para one-on-one, for her to learn how to ask her peers for help, ask the other teachers for help, to not rely on that one-on-one support, which has really helped her work on communication and independence skills. Now, when we talk about characteristics of students with multiple disabilities, a lot of those self-care skills impact them as adults as well. Right? Things like being able to dress yourself, toileting, bathing, eating, all of those things, feeding themselves, are all self-care skills that are related to those adaptive characteristics. For example, our daughter Josie has a feeding tube. One of our goals is for her to be able to do her feedings independently by herself. Right now she doesn't have the motor function to do those feedings by herself. But that is something that we know is really important for her as she gets older, to be more independent, to be able to go do that feeding and not have a para or a nurse come in and do the feeding for her. And so those independent skills, self-care skills, those are things that you want to focus on within the IEP for students with multiple disabilities. to have goals for those skills, to talk to the parents about what are the priorities for independence and for self-care skills. It's a great opportunity to really combine some of the needs at home and at school and have some goals related to those adaptive characteristics. Now, typically students with multiple disabilities also have some motor development dysfunction. Okay, they may have abnormal muscle tone, they may have really low muscle tone, they may have increased muscle tension, and so for example, if a student has cerebral palsy, they have increased muscle tension. Those muscles are really tight. Sometimes some of the kids that I've worked with in the past that had that would do, Botox injections. Sorry, the name slipped my mind there. And that releases some of the tension in that muscle. Josie actually had that done in her neck because she had torticollis when she was born, so she had a real definite lean to her head. The muscle on this side was really tight. So we did Botox injections, kind of loosened up that muscle and allowed us to do more stretching and get her head more aligned so that her vision wasn't so impacted by constantly having that sideways kind of look. These students can have a lot of difficulty even with something as simple as sitting independently, difficulty walking. The kid that you see here is called Silas. We call him Cy. He's a kindergartner this year. He has a couple of different trisomy disorders where some of the genes within his body during development got tweaked a little bit. And so you'll see him here. He's in a special walker that he uses on the playground at the elementary school that he's at. And it also is a stander. So you'll notice he has that piece on his chest that helps him stand up independently as well. You also notice he has braces on his feet, just helping with the feet to be flexed in the right position for him to be able to walk. And Cy's had a lot of issues with muscle tone, just really low muscle tone. So it's made it hard for him to learn how to sit. He can sit independently now, and really hard for him to learn how to walk. So he's still getting around primarily in a wheelchair, but he does use this walker at school sometimes. You know, it's fun to see, for me, in the setting that I typically am working with these students, which is a church setting, I see parents connecting. And so the student that I talked about here, her mom being really vocal about her being independent, well, her mom was talking to Cy's mom this year. Cy was getting ready for kindergarten, and they were losing Cy's one-on-one nursing care, which really was making the parents nervous about sending him to school, and he wasn't going to have Nurse Vicki with him, and how was that going to go? How were they going to take care of his needs? He's nonverbal. How was anyone going to know what he needed? And the other mom was really good about saying, hey, you want him to be as independent as he can be. This is a great opportunity for you to kind of let him grow a little bit and work on some of those independent schools. And the exciting thing is he's done awesome. You know, he has para support in the classroom, not necessarily one-on-one all the time, but he's getting used to different people helping him, communicating his needs, those kinds of things. Really great to see. But motor development is a big piece of the characteristics of students with multiple disabilities. For our daughter Josie, she has really low muscle tone, so she walked really late. She started walking when she was 2 with a walker and used a walker for a couple years before we had strength. We still have trouble getting up from a seated position on the floor the correct way. She has trouble dressing herself because of the low muscle tone. So, you know, the standing up and standing on one leg to put a leg in a pant, putting that leg down, sitting on the other one, that's really hard for her. Riding a bike has been a challenge. I think you'll see here in a little bit a video of her on an adapted bike that we got her. So this is definitely something that impacts learning, impacts how they participate in the general ed classroom, how they participate on the playground. So something that's important for you to know about. Oh yeah, there she is on her bike. That's Josie. So sensory needs. Kids with multiple disabilities oftentimes have a sensory disorder as well, whether that be hearing impairment or vision impairment. Now your book talked about if they have hearing and vision combined, there is actually a different category that we identify those students as deaf-blind. And in Kansas, we have a special school for students who fall within that category of deaf-blindness. Typically, those students aren't completely deaf, or completely blind. They just have a deficit in vision or hearing. And so we combine those disabilities together. There's some specialized instruction that we use for students who are deaf or blind. So when we talk about characteristics, though, of students with multiple disabilities, oftentimes you may have a student that has a vision impairment or a hearing impairment. For Josie, she has a hearing impairment. She identifies herself as being deaf, but she does have partial hearing in one ear. It's very hard for her to hear what anyone's saying unless they are speaking directly into that ear, and even then it's hard for her to process the sound. And I'll talk a little bit more about hearing impairments when we get into that module specifically, about how the brain processes sound, and if the brain isn't exposed to sound at a young age. So for Josie, she wasn't aided at a young age because we had a lot of ear issues just anatomically that had to be corrected. It really prevents the brain from developing those connections of how to process sound. So now for Josie, she doesn't process the sound the same way that you or I do. But in general, those characteristics of students with multiple disabilities, that's something that you oftentimes see is maybe a hearing impairment or a vision impairment. They may be aided, they may wear hearing aids, they may wear glasses, and those kinds of things. That is a picture of Josie's bike. Because of her low muscle tone, it's really hard for her to pedal a regular bike, and also balance-wise, really impossible for us to balance a regular bike. Even on training wheels, she felt very unsure and very afraid she was going to fall. So she has one of these Mobo bikes, which is a 3-wheeled bike. You can see it has a little brake there on the handle, and she gets around great on this thing. Rides much further than I thought she would when she got it. So it's exciting to see her kind of get an adapted way of doing something very normal for kids her age. The other piece of students with multiple disabilities that is really important for us to understand is that communication piece. Typically, these students have significant issues in communication. Oftentimes, we will find that they're nonverbal or they're very delayed in their communication. And there's some contributing factors for them that impact them in school with communication. This child that you see here in the picture, her name is Ripley. She has a very rare disorder, and she is nonverbal. She uses a communication device, an iPad, to communicate. Communicates very well with the iPad on her wants, her needs, her expectations. If you're irritating her, she'll tell you to go away, which is what she did to our volunteer here, John, which was kind of funny to watch her do that. Because she's got some opinions she's definitely going to share through that technology. But some of the contributing factors, even for Ripley, when she's in a classroom setting or a school setting, is there is a lack of interaction with her peers, and there has been, because her peers aren't sure about what she understands and aren't sure how to communicate with her. That further delays those communication skills. For her, she didn't have access to a communication device until she was in 5th grade. And that was significant for her because she had a lot to say. She had no way to communicate it. The school just didn't have the resources, the funding. There's a little bit of a lack of knowledge there on how to assess her communication needs, and so that impacted her. Also, sometimes we see in schools there's just a shortage of speech-language pathologists, particularly with specialized skills in communication devices, and kind of what that looks like. So that can impact students. And then really a lack of teacher preparation. You know, we don't get a lot of training in our pre-service teacher ed programs about how to work with students who have significant communication needs. And so that impacts these students in terms of what kind of access they have to specialized instruction and communication. So typically, just as in terms of characteristics, when you're working with these students, you're going to see pretty significant delays in communication for students with multiple disabilities. When we look at causes of multiple disabilities, typically those causes are going to come from some kind of genetic mutation. So for example, Cy that I talked about, he has actually a trisomy and a monosomy disorder. So I can't remember the numbers of the gene that got kind of tweaked on him, but he has an extra of one, and he has one where he's missing that completely. Now, typically these happen in a spontaneous way. Now, Fragile X, they talk about in your book, that can be inherited. And there are some that can be inherited. I work with a student who had a stroke in utero. She has a blood disorder that they found out was an inherited blood disorder. So those kinds of things can impact students. And then we have some that are just unknown. We don't know the cause of the disabilities. And there's still a lot of research going into finding additional causes that we can connect to. There's testing that can be done both prenatally and after birth to identify the cause for the disability. Prenatally, there's genetic screenings that kind of give you an idea of the possibility that the infant could have a genetic issue. And then there's diagnostic tests which tell us for sure that yes, this genetic mutation exists right now in utero. And those are all kind of choices that folks make during pregnancy on whether or not they do those screenings and those diagnostic tests. And then after birth, there's a couple things you can do. There's a chromosomal microarray, which looks at all kinds of different common issues in chromosomes that can impact children with multiple disabilities. We actually did this with Josie. Not necessarily that we want a diagnosis, but we do want to know that if she has a particular disorder or a particular genetic mutation, sometimes you'll know that it can kind of give you some predictive indicators for health issues or health factors down the line that we think would be helpful. For example, if she's identified with a particular disorder where we know kidney function is something that can really be impacted. We aren't having issues with her kidneys right now, but we need to know that so that we can be monitoring them. That's primarily why we did testing. Hers came back with no findings, so we didn't find out anything on that. So if that's the case, the next step is genome sequencing. And this is some new technology that's out there. Children's Mercy in Kansas City has a genome sequencing department where they are doing this. They are basically mapping out the entire genome, and they can really identify where there are tweaks and deletions and extra things that could be contributing to that multiple disability. For us, financially, that wasn't a solution right now. Typically, the only insurance coverage you can get for genome sequencing is if your child is on Medicaid. Otherwise, it costs about, I believe it was $5,000 to $7,000 to do genome sequencing. That cost is going to go down considerably. Insurance is going to start covering it. So for us, we just decided to wait a few more years before we looked into further genetic testing. But those are all important things, just kind of for you to know and have in the back of your mind as you're working with students with multiple disabilities. Sometimes you might have a parent approach you and say, hey, my child has 22q trisomy, and there's a foundation for that. And as a teacher, you can go and get a lot of information on the characteristics of that particular genetic mutation that can help you out in the classroom. So that's really the reason I want to talk about causes here, is because there are lots of resources out there related to very specific genetic mutations that can help you as a teacher just know your student better. When we're looking at evaluation and identification, we can do the typical assessments we've talked about in this course on students in terms of evaluating intellectual functioning and evaluating adaptive skills, those kinds of things. Your book really pointed out using the APGAR test as an initial test, which I think is helpful. And a lot of times you will see these kids come in already identified by the time they get into pre-K. Okay, because typically their disabilities are pretty involved. They had factors occurring early on that were a sign that something was going on, or even at birth they were identified as having some kind of disorder. So the APGAR test is one that's used frequently. Anytime that initial test is 4 or below, it will cause the doctors to look more closely at that infant for other issues. Okay. Also, any kind of birth defects, whether it's a cleft palate, a cleft lip. For Josie, she was right at a 5 on her APGAR test on the initial, which was kind of low, but still above that threshold. But she had some trouble with oxygenation, even though she was born at 37 weeks. She had an extra digit, so she had an extra little finger here. It didn't have any bone in it. It was kind of interesting, but it was just in the shape of a finger. had a little bit of a fingernail, and they removed that after she was born. But even that extra digit was kind of a red flag for the doctors that maybe something was going on. And so a lot of times when you work with these students, they're going to come in with all kinds of testing already completed. What I would say your primary focus is going to be on as a special education teacher, as a case manager, you're going to be looking at ways to meet that child's unique needs, right? And one of the things that's most helpful when working with these students is working through the SET framework. And this is a framework for evaluating assistive technology. And that doesn't mean, I'm not meaning really expensive technology necessarily. What I mean here is just all kinds of different things that can help them be more successful in the classroom, whether it's different seating and positioning options, whether it's some fine motor tweaks that we can do with different equipment, different types of pencils, different kinds of writing tools, all the way to communication, whether it's a full-fledged communication device or if it is even something as simple as just a single switch that they're able to hit and communicate one item. The folks that can play a really big role in this are related service providers, speech-language pathologists, occupational therapists, physical therapists, nurses, all can really play a big role in terms of that evaluation, identifying things that work for the student. When we look at including students with multiple disabilities, there's some really important things that I want you to keep in mind that I kind of wanted to point out to you as separate from the book. One is talking to the parents and the child about how much the child wants to participate, getting their input. For the student that I mentioned that's in kindergarten Psy, his parents were very worried about his peers, thinking he was different. So they kind of wanted him to have some time outside of the classroom where he could participate with special education students and be in more of a resource pull-out setting. The other student that I talked to you about that's in middle school, whose mom really advocates for her to be around her peers, it's really important to her, it's important to the student that she's in the general ed classroom as much as possible. So you kind of have to think about those things. Also, really helping those students have any kind of partial independence where you can maybe, instead of being dependent on a para support, for example, the middle school student I talked to you about, a lot of times she has peers assisting her, so she kind of gets that partial independence from adults, and the peers are stepping in and helping her. And then really promoting friendships is so important for these students, and it's important for their same age, typical developing peers too, to develop those friendships, to develop that sense of helping someone, of being accepting, of seeing that differences are important and are valuable. So that whole concept of promoting friendships is just really important for our students with multiple disabilities. I wanted to touch a little bit on communication needs here. When we're looking at students who are nonverbal or have significant communication delays, one of the things that we typically use in schools is augmentative or alternative communication devices. You might see them referred to as AAC, got that letter wrong, or a picture exchange communication system. So here you're not necessarily using a technology device, you're using images. Short for that is PECS. That's probably might be a pretty familiar word to you, where they're using pictures to communicate, so they're pointing. Sometimes we use eye gaze, so looking at where their eye is going and tracking. Same with augmentative communication devices. You can use eye gaze to manipulate these devices. They can do it manually with their fingers. However that works for them to be able to communicate. One of the things that augmentative communication devices are built on is this concept of core words. And core words are words that most of our vocabulary comes from. There's been a lot of research on core words, and it's a really effective way to develop a communication system for students with multiple disabilities. So Josie uses Prologo 2, which is a communication device on an iPad.